A very good evening to everyone. I would like to take this opportunity, first of all, to express my condolences, my deepest condolences to the bereaved family. And I would also like to mention that I know that they're going through a very tough time. And I would like to say that may God give all the strength to them this trying times to bear all this pain and difficulty that they're going through. Friends, we also would like to inform you that we have had a total of 118 tests that have the results of which have come out. 68 came out late last night, and 50 came out in the afternoon, late afternoon today. So out of these 118 cases, in the initial 68 cases, six had tested positive, and another six had to be retested. But the rest of those 68 cases were negative. And most of the people who tested positive were mostly the immediate family and house members of the patient. Apart from that, we received 50 results today from GMC, and out of these 50 results, all have tested negative. And we are waiting for another 43 from Barpeta Medical College. The results of that we should be receiving soon, but I don't have that with me right now. Apart from that, friends, I would also like to mention that different arrangements have been made to ensure that different people who were working in Bethany or were primary contacts have been isolated, and we're in a continuous process to contact, trace as many of them as possible. And the more the primary contacts which are there, we're trying to ensure that they are isolated and quarantined, and the testing is done at the earliest. In this, we'd like to inform you that from the government of Meghalaya side, we have made a lot of arrangements in all these locations. There are a number of Corona care centers. We have more than almost 600 isolation units that are ready, and all of them will be used for this purpose. I would also like to inform that arrangements have also been made to ensure that food and other facilities are provided to these people who are in the isolation wards. I received some complaints today that food was not reaching on time. Friends, I would like to clarify out here that the food has been reaching to the Corona care centers on time. But we have been having some challenges because the volunteers who were trained to distribute this in a proper and protocol manner within the Corona care centers were not able to reach the centers because of certain restrictions in certain localities, and maybe some families restriction, and some other challenges that they faced. I would like to urge the society in general and our headmans and rangbashnongs and elders that if they could be supportive at this time and allow these volunteers and other health officials and government officials to kindly come to duty so that our services are not affected. I can assure you that all the strictest protocols are being maintained, and these are protocols that are set by Government of India. So therefore, all these measures will be taken so that each and every one of them is safe. I also got some complaints about 108 and the helpline not responding at some times. Friends, I had made personally twice calls to 108, and both times I got response in a very short time. There are a number of calls coming to 108, and there could be situations where because of overload they are not able to reply back or answer the calls. I urge you to be patient and to keep trying, and I'm sure that 108 will respond. Friends, here I would also like to mention about contact tracing. Now, I have received some concerns about people saying that they have contacted 108, they have registered, but nobody has contacted them yet. Friends, we are really following a basic principle and protocols of contact tracing. What this means is the primary contacts are the most important and the first to be dealt with, and then we go into the secondary contacts. The primary contacts are the people who have come directly in touch or in contact with the concerned patient. Therefore, that would mean immediate family, immediate people in the house, immediate staff, and the people around or the people that the patient might have met on a day-to-day basis. So those are the primary contacts. Government and the protocol requires us to ensure that these primary contacts are first tested and quarantined immediately. And the protocol also says that the secondary contacts should ensure that they are isolated at their level and maintain where they are. And as per the results that come out of the primary contacts, then the secondary contacts will also be at the appropriate time tested if necessary. And secondary contacts are normally people who have indirectly come in touch or have indirectly been to a location where the person could have gone. Like in this case, the institution that we mentioned is a location, and a lot of people visited Bethany Hospital, and therefore they felt that they should be tested. So you will be in secondary contact, and therefore it will be a process that the protocol will have to follow. You need not worry. Please be cool and be calm. Just ensure that you maintain your social distancing and protocols. Of course, as you know, that out of the 118 cases that the results have come out for, most of them are staff from Bethany, and therefore it means the staff of Bethany, most of them have tested negative. So therefore, the secondary contact is something that is at a distance right now, but it is our duty to contact trace and ensure that we have a complete list of all the people who could have been in indirect touch or contact with the concerned patient. Also, there are some concerns about the people who are in Bethany right now. And I would like to inform all of you that the protocols have been set, and the people who will be testing negative, they will be shifted out to other corona care centers and to other isolation wards. And that process also will start today. We have, as I mentioned, almost close to 600 isolation wards, and those wards will be utilized to keep these people for minimum 14 days in the isolation wards, even though they'll be testing negative. So this process also is on because we would like to keep the people out of Bethany as far as possible. But as mentioned, there needs to be strict protocol that needs to be followed out here. And at the last, I would like to thank everyone. There has been a lot of support from the public. I've seen many civil society, NGOs, individuals that have come out and have really expressed their desire to help in this situation by providing food to the people who are in the corona care centers. Friends, it's a challenge for us because certain restrictions and movements and protocols are there. So it may not be possible for us to immediately respond to the support that you're showing. But I do take this opportunity to thank you, and we will try our best to connect with all of you and get all your help and support, and let the people in the Corona Center also know that the kind of message that you're trying to give to them. So friends, at the end, I would like to once again reassure you that we are moving forward, and we are ensuring that all steps are taken. There are challenges. It's not that everything will go smoothly. It's a very big operation with a lot of individuals involved, a lot of government machinery involved, and there are certain challenges that we face. But I can assure you that we will be resolving all those challenges that come ahead. I once again urge that in a situation like this, it is not just the government alone, but it is the society that has to come together. So I would once again appeal that we must come together, work together, and we must ensure that we maintain our social distancing, maintain our personal hygiene, and we can overcome this particular situation. Thank you once again.